MyStory, MyJourney, YourAwareness, which is aimed at promoting early cancer diagnosis for the population of Wirral and also across Cheshire and Merseyside. This is one of the community partnership programs between Cheshire and Merseyside Cancer Alliance and local CVS across the region.
My name's Lynne. I'm 60 years of age now and I come from New Brighton. I have a background in haematology nursing, the cancer haematology nursing, and a family I've been looking after for over a decade now.
My name is Ram Vinayagam. I'm a consultant oncoplastic breast surgeon and clinical lead for breast surgery and breast unit based at Clatterbridge General Hospital, which comes under the umbrella of Wirral University Teaching Hospital NHS Foundation Trust. Why breast cancer and the diagnosis, the treatment, early diagnosis is important. Breast cancer is the commonest cancer at the moment in UK. It used to be lung cancer, now it's the breast cancer is the commonest cancer. And 1 in 7 women get breast cancer in their lifetime. And the vast majority of the women, they haven't done anything wrong. They are perfectly healthy women and they're diagnosed with breast cancer. That's what more heartbreaking and upsetting for not only for the patient, the woman, and the whole family. However, the last couple of decades, the breast cancer treatment and survival has doubled up. More and more women are living longer after breast cancer diagnosis and treatment, and most women don't die from breast cancer, they die of natural causes. But the most important thing is diagnosing it early. If I diagnose the cancer early, almost all women live for at least 5 years.
I've always availed myself of screening of any sort really, for the cancer, cervical screening and then the breast screening when it was available. I was called for breast screening in 2017, just routine. I've had no problems whatsoever. They found a suspicious area then and they biopsied it for me, but reassured me that it was probably all fine, it looked fine. However, a couple of weeks later I still hadn't heard anything from them. So I ring them and they say, oh, the recall letter must have been lost. We need you to come in tomorrow. So you kind of know that that's not a good sign really. So I go in and they tell me that I have a certain type of breast cancer. Now from my knowledge, that sort of breast cancer doesn't have a very good survival rate. So immediately I was scared. I was scared. Worried about the family, worried about me, worried about my husband. The Macmillan nurse was amazing, just letting me get all that out really. I am Christian, so I immediately asked her to pray, and she was brilliant in that situation as well. So I had a lumpectomy, so some surgery, very small surgery. It was a very early detection. It was so small. It was almost unbelievable that it was even picked up at that point. So I had that, and then afterwards they talked to me about radiotherapy and chemotherapy. The data for chemotherapy wasn't clear because it was such a small cancer, they didn't really have any data on that, so that was going to be my choice, and I found that very difficult because even though I've been a nurse, I wanted hand-holding all that way. You just forget, you forget all that and you just want to be a patient. Anyway, again, I sought advice and sought God and decided not to have chemo. Well, I had 6 weeks of radiotherapy, which left me tired. I would take every step to the breast self-examination. You need to keep doing that regularly, find out how to do it properly and do that. Avail yourself of every screening that you're given, because the earlier these things are picked up, but also for the rest of your life, because that then changes your lifestyle. Well, I changed my lifestyle. My surgeon was fantastic, gave me some control back really, because you do feel out of control. It will tell you about your exercise, about your diet, all stuff that you really knew before, but it becomes very, very real. So yes, avail yourself of every every early detection method that you can find.
So with the early detection, the most important thing is knowing how your breast looks and how your breast feels. Because every woman's breast is different. How much breast tissue they have, how much fat tissue they have, the consistency, where they are distributed, it can feel different for each woman. So you need to know what is right for you. The right time to look for is after your periods, where the breast will be more calmer, it won't be engorged, so you'll be able to feel how the breast feels. What is normal for you, which area feels softer, which area feels firmer for you. Is it feeling same every month? Then that's absolutely fine. But anything different, you're feeling a lump or a thickening, or there's change in the skin, change in the nipple, the rash, the breast has unusually gone bigger, smaller. So anything you're not sure about, go to the GP. The GP should be able to identify there's anything going on, then you can refer to your specialist, which we will see very, very quickly. All women refer to us on usually within 2 weeks, if not maximum 4 weeks. We will take care from there. As I said again, 9 out of 10 are benign. So don't panic and stay at home. There is something terrible going on. Come and get checked. If there is something needs treating, if you find early, then we can treat it better. Lesser treatment you will need, and your prognosis will be much, much, much better, and you can lead a healthy life.